have put this talk off a couple of times actually, because we
For over a year.
for over a year. It's taken a little while to get here, but we're so excited to have more information to share with you about Norton Children's Research Institute and the future of pediatric research. So we wanted to call this talk Onward and Upward, just sort of pointing to the sort of turning point in pediatric research that we've just reached, and really the upward direction that we're headed. So we're going to spend some time this morning kind of orienting all of you to what Norton Children's Research Institute is, what we think the near and longer term futures hold, and really some information about what's in it for you. What is this going to offer you as members of the pediatric scholarship community? So this is our logo. You all are probably familiar with this kind of logo. It's identical to all of yours, except for it has Research Institute in there. So this is our new organization that is heading up pediatric research. So just a little orientation to NCRI. This is really a collaboration between Norton Healthcare and the University of Louisville, and it's organized as a joint venture. Which is to say it has investment from both organizations. Both groups have come to the table in different ways to say we support pediatric research and really try to make this a success. Our staff are now employed by Norton Healthcare. That's very similar to the way the clinical integration worked. The faculty research leaders are now dual employed. So several of us, Dr. Sullivan and I, Dr. Watson, Dr. Davis, Dr. Stevenson, we have appointments obviously in the university and also in the Norton Healthcare Research Office, and then NCMGE as well. So really the NCRI is responsible for supporting all pediatric research except for basic science. And by all pediatric research, we really want to highlight we belong to the Department of Pediatrics, as well as all pediatric service lines, including pediatric surgery, pediatric neurosurgery, pediatric neurology, ophthalmology, dermatology, all the groups in NCMG. We belong to you in terms of helping support your research and really helping to grow research in every pediatric field. And we're committed to doing that. We wanted to share the mission. Maybe I won't read all of this to you, but we really want to highlight that research here is really focused on making new knowledge that will improve the health and outcomes of children and their families. And we are really deeply aware that that doesn't mean just clinical trials, or in my case, just ethics research. It really means a whole portfolio of different kinds of research, including educational research, including clinical research, including data-oriented research. Really, we need an entire diverse portfolio of research in order to achieve this mission. And we're really focused on that. And except for the basic science dimension, which of course we recognize is extremely important, except for that one piece, all the other kinds of research are really at NCRI. And our goal is not just to do pretty good work, but to be a leader in the discovery and validation of new knowledge that improves care for children. And we really think there's an opportunity for us to grow into this leadership role locally, nationally, and globally. And if you look at sort of national rankings for pediatric research, there are some places that are in the stratosphere that will take us a while to be competitive with them, but we can really, just with a small amount of investment and some hard work from all of us, we can really move into much stronger leadership role nationally, and we really think that is very doable. Okay, we just wanted to give you some idea about where we're looking to go in the next couple of months, and then in the next slide, a couple of years, and really highlight what we think where our opportunities are. So right now, we're really focused on growing our staff to meet existing needs. Some of you who have worked with us have probably recognized both with our staff kind of waning over the last year or two, and a lot of hard work on this integration. We've just been really busy, and we're not meeting our existing needs. So we are really rapidly working to grow our staff to meet those needs, and this integration has made it possible in a way that was not possible before. But we don't just want to meet existing needs. We really want and need to lay the groundwork for future growth. And so we're working on that as we grow our staff. We are actively working on moving to a new space to accommodate that growth. We will later this year be moving out of the second floor of the Children's Hospital. I'll tell you a little bit more about that later. And we'll be joining our colleagues in the CARG unit on the second floor of the KCPC building. And we'll still obviously have a group in the Novak Center on the sixth floor. So anyway, we're really growing our space to accommodate team growth. We really want to focus on identifying key performance indicators, which many of us in medicine would think of as sort of metrics or goals. And the idea here is we really want to know how are we performing in the key areas of our work, and to be able to recognize where we're falling short. So things we're thinking about here are how fast are we turning around your IRB application? How fast are we able to go from starting the conversation with a pharmaceutical company to rolling out the clinical trial or COG? How long is it taking us to get grants up and running? So we really want to accelerate our timelines, and we want to do a better job with that. And we are actively building a team for developing new research grant proposals. That has been a project that is really a passion project for Dr. Steve Wyatt, who's our colleague in leading the Norton Healthcare Research Office. And we're already seeing some of the benefits of this work, but that's something we're working on. Okay, as we look to the next year or two, we have some bigger goals that we would like to work toward. First, we'd really like to expand the community of our faculty that identify as physician scientists. We recognize and really cherish the diversity of kinds of careers that we have in our department. That's, to be honest, one of the things that attracted me here 9 years ago, is that we have all different kinds of careers going on in our department. But we are low in the physician scientist category, and we really like to grow that. So we are working on developing a way to recruit 5 physician scientists, and we'd like to find folks who are able to establish new research programs that are paired with innovative clinical care. So we really think this goal is aligned with what Norton Children's Medical Group wants to do in bringing the best clinical care to the city, and bringing, making it possible for families not to have to leave to go elsewhere for clinical care. We'd also like them to not have to leave Louisville to get into innovative clinical trials they're interested in, or other kinds of research. We'd also like to support up to 5 of our existing junior faculty to really grow into physician scientist role. And we have several folks already working extremely hard in that area and showing success. Jennifer Porter recently received a grant from the NIH, and this could be more than 5, but we would really love to. We think we've got great talent in pediatrics, and we'd love to help some of those folks who are interested in having that kind of career to really move into a physician scientist kind of role. We are really excited about the opportunity to create a training program in pediatric health equity research. This is a passion project for Debbie Davis, but she's really done great work. But I must say this really reflects the mission of our of Norton Healthcare and the University of Louisville in a bigger way. So we really think establishing a training program to do health equity research led by Dr. Davis would be an extremely good fit for our pediatric enterprise. And then we don't want to focus entirely on numbers, but we think some numbers are really helpful to look at. And we'd like to increase our annual NIH funding. This year, 2020, we were $380,000 annually. And we really like to see that number go to 1.5 million within the next year or two. And we think that's very doable. And just to point out the kind of opportunity that we have, just moving from 380,000 to 1.5 million would increase our national ranking by over 20 slots. So there's really a huge opportunity here from just relatively small changes. Okay, organization. We really want to give you an idea of what NCRI is and how it's organized, and to help you kind of understand how you can interact with us. So I remember coming here 9 years ago and really being confused about the different research groups. There was kind of, all these different letters. Cards wasn't a thing yet, at least not in the way that it is now. The KCPCRU, we had the PRI, we had the CTU. There's all of these different groups. And over time, I've really realized there's a lot of collegiality, but a lot of opportunity to sort of be more effective by centralizing some functions, allowing some folks to work on the things they're great at and not be bogged down with other kinds of tasks. So we're really focused on breaking down the silos, and you've already seen that, I know, over the last 5 years or so, but we're really centralizing all of clinical and translational research into NCRI, working together very closely. So we want to eliminate the silos that we've had within PEDS research. As I said, we've got all these different groups who we're working together very collegially, but in some ways in the not the most efficient way that we could. And then we've had silos that separated pediatric research from the Norton Healthcare Research Office, which create a lot of duplication of effort. We had this system where we kind of had a serial review where first you had to get one approval and then you had to get the other approval, and it really extended that process. And we've been working for the last year behind the scenes to really reduce those, both the silos, but also the duplication of effort. So the goal in eliminating silos is really to work more efficiently, reduce that duplication of effort, maximize our collaborations, and really, as a result, strengthen our enterprise and our infrastructure. So NCRI is really allowing us to do that. Okay, this is a very simplified org chart, but I thought it would help kind of demonstrate our current arrangement. So just starting at the top, many of you know that JPAC is a body with representatives from the University of Louisville and Norton Healthcare that advises our Pediatric Academic Medical Center and makes those decisions between the two organizations about how NCMGE and our broader Pediatric Academic Center works. So we created what is essentially kind of a subcommittee of JPAC, the Joint Pediatric Research Oversight Committee, JPROC. And that is similarly a group composed of Norton Healthcare key stakeholders and the University of Louisville stakeholders to really provide guidance on how we operate as a pediatric research group, and is accountable to both organizations. Then we have the NCRI leadership team, which I'm going to show you in the next slide, which is working together over all pediatric research. And then we have what are essentially three teams. We have the NCRI administrative team that covers finance and regulatory. This is similar to what used to be part of the KCPCRU, but that is not a thing anymore. Then we have the NCRI CARD unit, and the CARD unit, as you know, works on health outcomes research with a specific focus on health equity research, lots and lots of data science, and with our statistician team. And then we have NCRI clinical research team. There's an inpatient and outpatient wing of that group, and they really work on clinical research writ large that includes clinical trials, but is certainly not limited to clinical trials. So this is really how we're organized, and unlike in the past, we really have just these three groups. There's no other groups, and we're working very closely together. Wanted to give you a picture of the leadership team. This is really in the faculty category, and at the top you can see Matthew Hawthorne, who's the administrative director for NCRI, and then me, I'm the chief scientific officer for NCRI. And Matthew and I work together as a duo to head up NCRI. And then we have key folks who are familiar to you who play very important roles in NCRI. Jane Sullivan is assistant chief scientific officer, and as you know, also vice chair for research. So she is our mentor and founder, as you know. Then we have Michelle Stevenson, who's director of research development, Debbie Davis, who is the director of the CARD unit, and Sarah Watson, who's the medical director for clinical research. So this is our faculty leadership team, and we have been meeting with this group now for more than a year, working on a lot of the issues that are holding us back. And then this should say our staff leaders. This is folks, many of whom are probably familiar to you, who are heading up NCRI. Jen Cummings is the director for NCRI clinical research. Working with Jen is Kristen Gossett. She's the manager for NCRI clinical research. And ultimately, we'd like for Kristen to be the manager for inpatient and have an outpatient manager. Right now, Kristen's the only manager, so she's really covers everything. Sarah King is the operations manager for NCRI. She heads up regulatory, finance, and a lot of really big picture for all of NCRI. And then you all may know we recently lost Natalie Pasquenza to an opportunity that she had, so we're looking for a new manager for research development and support who will serve in that important role, which includes being the manager for the CARD unit. Okay, and just to give you an idea of staff growth, we are currently hiring 16 positions, and included in those is a CARD unit manager, as I said, a financial team leader, which we have been without for 2 years, multiple research nurses, some of whom are coming very soon, research coordinators, a research assistant position, several regulatory specialists, a regulatory analyst, budget analysts, billing and accounting staff, totaling, I think, 6 people. And so all of it, we're interviewing for many of these positions, or they're posted right now. We'd really welcome you all referring folks our way. If you know of folks who have experience in research, that's obviously not super common. But if you just know really great nurses or folks who do office kinds of work who you think would really be a great fit for our team, we'd love for you to send them our way. And then there's obviously going to be a period of time where we're hiring, and then we're training the new staff. And that's very time consuming, especially when you're understaffed like we are. So there is going to be the next couple of months are probably going to be slowly ramping up to see a better quality of service. But then we really expect to start really showing a lot of strength in both clinical research and the regulatory and finance side of research. Okay, and before I hand it off to Jan, I just wanted to give you a little bit of a picture of what we're working on in the KCPC. So we are renovating a segment of the second floor. I think you all probably know the KCPC building is the brick building across the street from the Children's Hospital where the chair's office is. So this is on the second floor. We anticipate moving in September 15th. Right now they're pulling down wallpaper, and we'll be putting in new flooring, those kinds of things, office furniture. And then we'll continue to have a small touchdown space and lab in the Children's Hospital on the second floor in our existing space. So good things to look out for there. Now I'm going to hand it off to Jan.
Good morning. Thank you for joining us today. We are so excited to be at this point where we are complete with the integration, and that's just really a starting point now for us to further strengthen and develop our infrastructure support and hopefully advance the scientific rigor and our research capabilities here at the university. We had our first official meeting for integration in April 2019, so it's taken us a little over 2 years to get here, but we're excited about where we are now. So I wanted to talk to you this morning about access to research support. Obviously, we're not going to be in our final stages here. This is going to continue to be a work in process. And I thank all of you for your patience. I know that you have submitted things to us. We've had delays, but we have not been allowed to hire staff for well over a year. And so now that we are able to hire staff, we're really hoping to be able to improve our efficiencies and be able to respond to your needs. So why do we care about access to research services? We really are wanting to have a single point of entrance where you can request needed services. We think this will be much more efficient and much more timely, and you will know one place that you need to go. And the services that would be available are, you may need study design help, you may need just an IRB submission, maybe you need biostat support, etc. So we'll have one point of entry where you will be able to identify what services you need, and you will be routed to the appropriate person, hopefully very quickly. We want to decrease the time to approval for whatever you're working on, from the time you submit it till you get it to the point where you can conduct your project and bring it to fruition. And we want to reduce the frustration, uncertainty, and the duplication of effort. We know there's been a lot of duplication of effort, and not just on your side, but on our side as well. For example, for industry-sponsored studies, we had to have compliance approval at the university to make sure that insurance wasn't being billed when they shouldn't be billed for projects. But we also had to have that same process, compliance process, on the Norton healthcare side. Well, now with the integration, we have gotten rid of the one on the university side, and only Norton Healthcare will need to do that compliance approval. So if we can continue to work on things that reduce these duplication of effort and make sure that we really have an efficient process, that'll be really important. And then we want to be able to help you navigate complex systems, and those systems exist both internally and externally. And an example of that is right now we have the IRIS system that is used for IRB submissions. It's used for grants and contract submissions, but there are not simple instructions when you go into IRIS, and things such as completing a scientific review and sign-offs, etc., are not always straightforward. And the other thing that's happening at the university, which is going to make this even more complex as we move forward, is the university signed an agreement with Cayuse. So right now, they use IRIS for both the contract and grant side and the IRB side. However, in the future, they're going to use Cayuse for the contract and grant side. So there's going to be another whole new program to learn. Plus, they're going to use IRIS, stay with that for the IRB, and they're going to be upgrading that. So complex systems, lots of things to learn and do. And so hopefully we can help navigate that. And then we want to make sure that we incorporate mentorship and optimize the quality of research. And we want the faculty to be able to focus on mentorship, developing their research, conducting their research, and not have to worry about what I call the nuts and bolts, the IRB submission and those kind of things. That hopefully we'll have the staff that we can be able to support you to do that well. And so we've been working behind the scenes to kind of make all these things happen. We've had a compliance group that has been harmonizing policies between the institutions. And this has been an incredible team that has done that, looking at university policies and Norton healthcare policies and coming to agreement on how these things are going to be handled with NCRI. And they have just been an amazing group, very efficient, did a solid job for this. And so they will continue to be in place as we move forward and address issues as they arise. We continue to do crosswalk of the policies between U of L and Norton to decrease the duplication of effort and make sure that we have the best things in place to help us do a great job with our research. And then other work that's been going on behind the scenes is clarifying procedures for requesting, receiving, and storing data. The NCRI leadership team has a monthly meeting. We are, during these meetings, setting up time to meet with specific people to try and address these areas. So this past week when we met, we talked a lot about data and EPIC and how to get data, receive it, store it, etc. And so those processes are being worked through, and hopefully we will have a way for you to get the data that you need for your research or preparation for research in a very efficient way in the future. So more to come on that. I want to now kind of switch and talk about our website, and I think this is going to be a very user-friendly website as we move forward. I want to say a big thank you to Michelle Stevenson for leading this initiative and really helping us kind of move this forward and partway crossing the finish line this past week. Diana Stover in the chair's office have been very helpful. Sarah Watson, Kyle, and other faculty members have really contributed to this, as well as staff members, and have really played a key role in developing this. And I think you will find this website very user-friendly, and we hope that as you utilize this, if there are ideas or suggestions that you have, that you provide feedback to us. So this is the Department of Pediatrics webpage, and over here on the left you see the pediatric research link. So if you click on that link, it takes you to a link where there's multiple choices here, the overview, the research leadership, etc. But there's a tab on there for medical professionals and investigators. And so if you click on that tab, it takes you to a link where you can, or to a page where you have links to multiple resources that are available for you at the university. And to Norton Healthcare Research Office, there's a link there to that, the human subjects, the IRB, and the sponsored programs, etc. And so this will be here readily available for you. And our goal is we are working at the same time with Norton Healthcare so that we have links on both websites to guide you to pediatric research. And so there's a lot of work still being done on making that happen on both sides, but we're excited about this because I think it will help us both internally and then our public-facing pages to have better access for people to know what we're really doing for research. There also is going to be a tab on here for access for pediatric research for internal resources. And this is going to be key for faculty as they work on their research. So this is, when this page comes up, there will be multiple tabs on here. There's going to be a tab on here for recognition of faculty and staff, and that will include listing of publications, presentations, etc. And for the publications, I will just say Michelle Stevenson has done an incredible job here working with Rebecca Morgan. And we've been able to, through the work that she's done, pull all the publications for faculty from 2018 to now. And she's pulling these quarterly. And so we will be having our publications posted here. There's also going to be a link here for you to self-report your research achievements and presentations. So while we can do this library search and find your actual publications, it's much more difficult, as you know, to find abstracts in your presentations, etc. We can capture some of that on Folio, but we can only capture that annually and only what you submit in there. So there's an opportunity here for you to provide that feedback to us so we can get those things posted. And then there will be links here for collaborative opportunities, and so hopefully that will provide you useful information, help you to connect with other faculty and learners and staff to network to be able to do your research. And there will be a faculty development link, and as you know, we have the Pirates Research Conferences monthly, and the recordings of those will be on here, so you will be able to, if you miss those, go back and listen to those, or if you think you want to go back and listen to something someone said and you can't recall it exactly, those will be available. So that's exciting as well. And then other faculty development opportunities will be here, such as asynchronous learning, etc., which Michelle Stevenson is leading. And then, like I said, the request link will be coming soon, where you will be able to go in here and click for your access to services for exactly what you need, and it will hopefully be a very intuitive process where you will be able to click in here, submit what you need, and get feedback very quickly and be directed to the appropriate services. After grand rounds today, an email will be coming out from me with the link to this website, so hopefully you will take some time to click on that and do some exploring yourself. I just want to recognize the Pirates team, we're called, which is the Pediatric Innovation Research Advisory Team. So, excuse me, this team was created about 2 years ago when I became vice chair for research, and currently we have 13 members on this team, and they have diverse research interests, but they're recognized leaders in clinical research and basic science research in the Department of Pediatrics. And for this team, we have included Lou Kai from Basic Science, because we really would like collaboration between basic science and clinical and translational research, and so we're happy to have him part of the team as well. And so when this team started, we spent time initially developing the mission and vision for pediatric research, and we developed that in knowing that the integration was coming, and so we developed that inclusive of Norton Healthcare with that vision in mind. And so one of the first policies we developed was related to the protection of time for pediatric research. So these research thought leaders meet monthly, and one of our goals is to inform internal policies and procedures, and so protection of research time was really important. What does that mean? And Dr. Bolin has signed off on that policy. We are working on strategies for growing pediatric research, and this is not done in isolation with just the Pirates team, but with input and feedback from Norton Healthcare, from the University of Louisville, and others with a vested interest in research, including the Children's Hospital Foundation. And then we want to identify ways to incorporate accountability and scientific review as needed into our process. It's really critical that we strengthen our scientific rigor for pediatric research. If people are investing time and effort to develop a protocol, we want it to be the best protocol it can be, something that's feasible. When you have the study completed or whatever project completed, that you will have data that you will be able to publish, and we want to make sure that things go through to completion and get done, because there's a lot of time and energy that gets invested in these, and if it's good research, we want to make sure that we get that out there and get published. And then the other goal of purpose for this team is to provide feedback on NCRI's performance as we move forward, because one of the things we want to really make sure that we're held accountable, that we provide the services that we need to the faculty within the Department of Pediatrics and Norton Healthcare. And this team also provides input on monthly research conference topics. They really helped. Initially, we sent out a questionnaire to try and get feedback from faculty on what do you want for a research conference, how often do you want it to meet, etc. And so this team was really key in helping us move that forward, and then helping us kind of design the whole research conference and the topics that are being utilized or presented. And then we want to make sure that as we move forward, that input continues. Current things that the Pirates team is working on is, the first one is we're going to expand representation of pediatric investigators outside the Department of Pediatrics, so that our Pirates team is inclusive of that representation as well, now that NCRI has been created and we cover all of pediatrics. Like Kyle said, we have pediatric surgery, neurosurgery, urology, ophthalmology, etc. And then identify areas for strategic growth. We really want to take our research now and take it to the next level. And like Kyle said, we have a lot of opportunity to move up in the rankings, which, you know, may not take all that much effort to get our position much improved from where we currently are. And then the other Pirates initiative right now is to inform the creation of a scientific protocol review committee that is really focused on improving quality and accountability in pediatric research. And this really is a whole spectrum, and it's not to be critical of the research you're developing, but to help it to be the best it can be, and to help you with help mentor faculty to help them achieve what they really can achieve to their full potential, and to make us more competitive when competing for foundation grants or NIH grants, etc. So we really want to have quality and accountability when we're looking at the clinical research that we do. So one of the things you may think about is opportunities for pediatric investigators, or what's in it for me. Or you might be, if you're a division chief, thinking what's in it for the faculty in my division, what's in it for my colleagues, etc. And so we really want to help you get what you need to be able to do the research you can. So as I mentioned, we're really working on right now expediting EPIC data requests, so you can do feasibility for potential study, that you can develop your grant, chart review, health sciences research, etc. We want to make sure that you have the data available for you to do that. And we're working on a protocol right now that will hopefully help simplify and make it much easier for you to get the data that you need to do those things. And then we want to have an expanded support for grant development, including grant writing and budget development. And we know that that's been somewhat limited in the past. Dr. Wyatt, as Kyle said, has been very supportive of grant development. And if we're going to move ourselves up in the rankings, we really need to be able to do that. They have hired Jeff Weiss as a coordinator for research grants, so we're working with him currently to help train him and help him learn what needs to happen when you do grant submissions, etc. Kind of expand. He has some experience, but expand his experience with federal grants, etc. So we really are encouraged that we will have better support for grant development and be able to help you do those efficiently. And I think the centralization of resources, etc., will help us do that so that you have what you need to get grants. And we're really working as a team to grow this. And then faculty development, as we talked about, is a key thing, and writing winning grant proposals. And so Dr. Watson and Dr. Devlin have an NIH grant called the Kentucky Pediatric Idea Grant. And as part of that grant, faculty development is one component of that grant. And we have offered this seminar in the past, but it is coming up again in October. And it is an incredible seminar, very, very well done. And even if you never plan to write a federal grant, it helps you, even if you're writing other types of like foundation grants, etc. And this is free. The NIH grant is paying for this because faculty development is a key part of this idea grant research. And it goes from 8 to 4:30. And I would encourage fellows and junior faculty especially to consider signing up for this. And if you can't attend in person, this company has allowed us to record this, and so it will be available, but only for 30 days after the presentation is completed. And it's really a great resource for you if you want to have a better idea on how to approach and write grants. So I'm going to just back over to Kyle for.
So we just wanted to look at the the big picture and the longer term, and say what would after we get through this sort of like meeting everyone's needs and kind of getting through the initial growing phase for NCRI, where would we like to go? And we have some great ideas we're going to be working on. We would really like to improve matchmaking between mentors and learners. Some of you may have had this experience. A medical student emails and says, hey, I'm interested in pediatrics, I'm interested in research, is there something I can do? And we'd really like to do a better job of making it easy to find, for investigators to find those folks who are willing to help, and then also for the learners to find mentors, investigators to work with. So we also would like to create a small grants program in partnership with Children's Hospital Foundation in order to make it possible for our faculty to find pilot funding and really get not just a single research project, but a career, long research program underway. It takes money to get those things started, so we really want to start to build that kind of resource. As I said earlier, we want to expand faculty to include more physician scientists, and we want to expand support for junior faculty, as I said, not just to develop a single project, but really develop a coherent research program that goes from project to project and builds over time. That's really a great way to build successful research. And we're extremely lucky to have Dr. Stevenson heading up those kinds of efforts in her role as Director of Research Development. And just some quick things that she's been working on: the Pirates Conference, the monthly research conference, tracking research productivity through publications, and building the website, and providing synchronous and asynchronous research modules for faculty development. And really, mentorship of junior faculty is going to take division chiefs and really the entire department but Dr. Stevenson is really heading up that effort and is a resource for everyone in the department who is thinking about getting a research program and a career with scholarship off the ground. So really want to draw attention that feel free to reach out to Dr. Stevenson for that kind of support. Okay, this is our last slide really, and I just wanted to say Dr. Sullivan and I were talking about how to thank everyone who has been a part of this, and we realized we can't thank everybody because it would take slide after slide after slide. It's really been a humongous effort to make this happen. We've had great colleagues on the university side and Norton Healthcare side contribute in 100 different ways. But we really just want to make it clear that NCRI it did not, come into existence out of nothing. It was not Dr. Sullivan and I working alone in a room together. This really was a project that has taken years to get here. It's taken support from both organizations' leadership. It's taken sacrifices from both organizations and taken investment. And a lot of folks have invested time to really help us. So we just wanted to thank the village that helped to raise NCRI. This is actually the village I grew up in. That's where this picture is. And we just want to say that there's more work to do. We're still really working to make NCRI, the world-class support system that we want for pediatric research to fulfill the expectation that we support all pediatric research, not just the Department of Pediatrics. There's really a lot of work to do. We'll continue to be in touch with all of you, and we'll continue to work with everyone to make that happen. Okay, we wanted to have time for questions and discussion, but first we were hoping that Dr. Wyatt is still on and would be willing to say a few things. Dr. Wyatt, are you still on? Maybe not. Anyway, let's open up the floor for questions, comments.
Is there any in the chat?
Let's see. Yeah. Dr. Schickler asked, is there community representation in JPROC? I will say, no, there's not community representation in JPROC, but I do think that that's, Dr. Wyatt says he's still on. Dr. Schickler, I think that's probably not the right place for community representation, but I do think that increasing both parent and community input to our work is a really important direction to go. So we'll be looking for ways to include that kind of input. And any expectation of easy access to Allscripts data?
Can I back up and say something on the community engagement? So we have been working, Sarah Watson, Lori Devlin, and myself, regarding community engagement and the KeyPERT grant. We have established a respiratory community engagement team, but we're hoping, we've been reaching out, we've been building bridges. We're working not just locally, but we're establishing collaborative relationships with Owensboro and Paducah and Frankfurt, and we have some people who have agreed to work with us on that. And community engagement is very important, and we realize that. And hopefully, as we move forward, we'll be able to strengthen the community engagement and have we think we want to have like a centralized team, and where you can bring in ad hoc members for depending on what your topic of interest is. So if you have something related to sickle cell, we right now have a very strong relationship with the community organization in sickle cell disease. So you can bring that expertise in from the community. So we're working on building that. That's very important. Thank you for bringing that up.
Okay, and then Allscripts data, you may know the adult side switched off of Allscripts recently as well, so I'm not even sure that it still exists, but once we get Epic access better sorted, we'll return and to answer that question. No news on that right now. Let's try it. Dr. Wyatt, you want to try again? Julia, could we try to unmute him if he's muted?
Yeah, I've been trying to see if I can control his microphone for like an unmute, and there's no option for that. But I'm seeing that if he has an unmute button, that he can unmute.
Okay. Any other questions? Yeah, I'm going to put him on. Hey, Dr. Wyatt, I've got you on speaker. Do you want to?
I'm going to hang up on my landline.
That sounds good.
We can hear you. We can hear Dr.
Everyone can hear you now.
All right, can you hear me, folks?
Yeah.
Can folks hear me now?
Yeah, they should be able to.
Great. I'll turn my sound on. Challenges. I couldn't get through the firewall at Norton Brownsboro. So good Friday morning, and thanks for letting me join y'all. Indeed, it's been a 2-year plus journey, but folks, it's going to be worth it. It's going to be worth it. I love the theme, Onward and Upward. Y'all have done a lot of great things, and our goal with NCRI and the collaboration between Norton and U of L is to support y'all with an infrastructure that helps you accomplish your research goals individually and then collectively as a department, and then moves Norton Children's Hospital forward as well. Just to quickly, I spent 20 years almost at UK, and I helped during that time. I got NIH and CDC funded research during all of those years as a PI, and helped build our clinical and translational science center that was NIH funded. So, I understand your needs, and I understand the importance of infrastructure to surround y'all to make your job easier from a research perspective. And customer service is very important to us at Norton. Very, very important for our PIs. Just so you know, Norton has a very robust research program. We have 400 to 500 clinical studies a year that we open. Of those, 150 or so are intervention studies. The other are data-driven studies or investigator-initiated studies, quality improvement studies. So our biggest part of our portfolio is oncology. And but actually during COVID, we guided 15 plus intervention studies for COVID-19, and actually we're the first to accrue for 3 trials in the world. We guided the Janssen COVID vaccine study as well, and accrued about 250 folks. And with my UK colleagues, we were the leading enrolling site in the world for Janssen. So we have a really nice infrastructure. It's almost like a mini sponsored projects office. And one of our goals is to improve efficiency, as Kyle and Dr. Sullivan have talked about, to build your staff up. We know you're thinly staffed. It's going to take a little bit of time, but we will get you there. Faculty recruitment, I've done a lot of faculty recruitment during my years, and one of our hopes is to work with the foundation to identify resources for packages to go help bring in some folks from the outside to build your infrastructure. And one last point, I love the thoughts of, I like thinking about breaking down silos, but I have always used the word silo spanning, because the reality is silos will always exist. Sometimes the goal is to bridge those silos. And I think that is realistic for us, and we will get there. So thanks for letting me join you this morning, and I hope, I apologize for technology challenges, and if I can be helpful, always let me know.
Great.
That's it, folks.
Thanks very much, Dr. Wyatt. So Dr. Wyatt, everybody, I should have said his role. He, I should know your specific role. He's heads up the Norton Research Office. So any other questions, anybody? I think we're running out of time, but we have a few more minutes. Any questions about Norton Research Office? Okay, well, thanks so much for joining us this morning, everybody, and send us a note if you have any feedback for us or any thoughts, and we look forward to working with all of you. Thanks.
Thanks so much, Dr. Brothers. Have a good day, everyone.
Hello.
Yeah.